So could we start, please, if you would give your name and just a bit about your work and educational background and where you were up until January of 2020, just prior to COVID becoming a thing.
Okay. I'm formerly known as Zandra Lewis, which was my professional name, which I kept throughout. I'm now known as Zandra Preston, which is my married name because I'm obviously not in a career position anymore. So when prior to COVID and going way back, I obviously became a registered nurse in 1985 and have had various different NHS posts. Worked in an ITU, worked in care of the elderly, did a little bit in high-end surgery, which is not quite ITU, but is the next step down. Then my mother has been always into private hospitals. And so I worked for her for a while, which was with, worked very closely with Stoke Mandeville, and it was with spinal patients mainly. And then she built another area, which was for surgical patients on the top. She decided to move into nursing homes, and she was building a home that had 30 beds, but it was a residential home, but she was making it into a nursing home. So it went from 30 to 60 beds, and she asked me to come and help her develop the staff because they were quite old-fashioned in their ideas. They had no knowledge of how to do a care plan and how to, when sort of more in the days when more paperwork was needed. So I basically turned a 30-bedded into a 60-bedded nursing home, trained all the staff up. Then I moved over to the Isle of Man, and initially I worked as a ward sister in Newlands, which was predominantly for rehab of the elderly. I got a post virtually straight away, which was quite nice. I enjoyed that until then my mother decided they'd moved over here, and they decided that my mother was supposed to be going into retirement and she needed a project. So hence Abbotswood was born, because she was great at building, seeing things, because she was a nurse. So she built Abbotswood, and that opened in December 1994. And she asked me to come and work for her. Initially, I wasn't going to, because I had a nice position at Newlands, but then they decided to cancel all my courses and things because they thought that I was going to go. So they did all that, and I thought, I'm not working for an organisation like this. So it was still like that back then. And then Abbotswood was born, basically, and it was a 60-bedded nursing home. Well, initially it was 40 beds, and then we put an extension on in 1999. And that was an EMI extension, which is elderly mentally infirm. Also throughout that, career-wise, educational-wise, I did a degree in health studies, BSc honours degree. I then went on to do, I was one of the first on the island to do nurse prescribing, which was another degree, which was probably the hardest thing I've done. I also got my PC postgraduate certificate in education, so that I could teach, because I loved the teaching part of things, and also for student nurses that were coming into the nursing home. And I also went on to do my A1 and V1, which is an assessor's award for City and Guilds, so that again we could train our own staff up to do all the things that were actually coming on board at that time. So that was throughout the sort of whole of, as well as lots of other different areas. So that's basically the progression of me over the 30 years. I was basically at Abbotswood until 2020, when my job there had changed. Initially, I was a nurse on the floor, working 5 days a week, 13-hour shifts, because when you start a new business, that's what you have to do until you build up your staff and your clientele and everything. And then I started learning the business side of things as well, because my mother used to be the administrator of the whole business. And then I kind of moved over into what I call the easy pile of administration, and then grew from there until then my job role changed. I was always the registered manager there up until my health started to deteriorate massively when in 2012 I had my second heart attack, and so I used to get tired a lot easier. And then I had to kind of step back and take a more administrative role, but I was always there for the residents. I was always like the old-fashioned matrons in a way, going around checking everybody. I'd hear report, I'd find out if somebody was ill, I would go straight to those people, check them if they needed anything. Again, at weekends, I used to pop in at weekends. I used to go and because I was a prescriber, I was able to prescribe medicines for people over the weekend, so that it didn't mean they had to wait for a Monday for a doctor. So we had a very, very close-knit kind of family there. Everybody knew their jobs and everybody sort of knew who to go to for specialities. One of my nurses was really good with wounds and wound care. So, you'd go to her if you wanted advice and sort of say, what do you... So it was very much a teamwork, I suppose, with me at the helm. And then 18 months before COVID, alas, I had another heart attack, and that took me basically off the floor. And I would only go back onto the floor if I still look at my residents every day and go around, but it took me off the floor. And I mainly then did admin. And although I was still a nurse, I was doing the running of the business, basically, making the decisions, upgrading things. So I then became what they call the responsible person. And I brought in 2 other managers who weren't nurses, but they were very good at what they did. And so they started to manage the home. And then as a responsible person, I only actually needed to go in, according to the rules and regulations, twice a year to do an inspection. But I was there every day because it was my business, it was my home, it was my reputation. And at the time, before COVID, Abbotswood had had an excellent reputation. So...
Coming on to the COVID period then, can you give your recollections of how that unfolded from really when you heard about this potential virus to the stepping up of the regulations to then what followed of the government becoming directly involved in that?
Yeah. Obviously, back in the November, we'd heard rumblings, from China and everything. And, anybody that reads the news or reads the wider sort of thing thought, We'd already had a contingency plan, which I'd had for quite a while. Prior to COVID, I'd had it really because if the boats don't sail, you don't get the equipment to look after the residents. And so it was for things like that, for disruption. And it was also when the first SARS came out. We all had to do contingency plans to what we would do if there was either a flood, an earthquake, a pandemic. So we all actually had, I presume most of the nursing homes had their own contingency plans for exactly this situation. So from the December, I started to plan. And I started to bring in stuff from the UK by any means I could, either by Amazon, by other suppliers, and started to stockpile things like, just washcloths, aprons, gloves, universal precautions, which is what you need to look after residents, because no matter what they've got, whether it's diarrhea or vomiting, or whether they've got hepatitis A, C, or they've got a cold, flu, you still need to use your universal precautions on all your residents. So I'd started to stockpile hand soap because, again, everybody was trying to get hold of sanitizer, but at the end of the day, washing your hands is the most effective, and it always has been. So as long as you wash your hands between patients and you do it well, and then you put new gloves on and a new apron on, then that is the proper way of doing things. So, and we've always done it, and we did have a certain degree of masks, which some of my staff used to wear them prior to COVID hitting, and I used to say, "What are you wearing that for?" And they'd say, because they'd wear it all day. And I say, "What are you wearing that for?" "They only last 20 minutes. And, so why are you even bothering to wear it? It's not going to protect you, only if you're going into a room and coming out. So I tried to do all this. I also put a sink in the main entrance. So everybody had to wash their hands before they even came in the door. It was like a little vestibule. So we put a sink in that. We basically did cancel all annual leave when it started to get, a little bit hairy. That was before they actually closed the borders. So we had 2 containers full of stuff. Also food as well. I closed down a bathroom and we put food in there, dried foods, so that you could make, so if there were, you could make eggs and things like that, and you could still feed the residents with nutritional stuff, just in case you couldn't get it fresh, because we just didn't know. So we had 3 months supply of food. We had 3 months supply of basically what I call disposable items, pads, everything, as I said, 3 months of everything. And we had it all locked up in containers, just in case. I'd done all that. I was finding hand sanitizers difficult to get. Nobody would supply them with me. And then when things started to when you saw all the media hype and everything that was going on in the UK, we got that, a good month before the Isle of Man sort of cottoned on. And it was the fact that most nurses, as well as nursing homes, were actually given the hazmat suits. And I tried to get hold of some of those, and there was none available. So again, certain staff were wearing aprons and putting bin liners over the top of their uniforms as well, and using that as a way to stop the virus. I'd be like, what are you doing? But anyway, so we actually closed our home to visitors and because although the government said there was nothing on the Isle of Man, we knew there was. It was obvious that there was. That it didn't just happen on one day and then, the first case or whatever, that's the first known case. So we had 2 weeks prior closed the home to visitors. That was on the Mothering Sunday, which was in the March. And I said, no, I don't want any flowers, any whatever. I don't want people bringing stuff in. At the time, there was a lot of scaremongering about even post, could be holding the virus. So, everything was kept in the vestibule for 24 hours before it was even picked up. So I thought, anyway, I don't know. When they announced the borders were closing, that the first case came on, I was told by my GP to, to look at all my staff records and to seek out anybody that was what they called classed as high risk, and to do a risk assessment to take the appropriate precautions. Now, one of my staff in particular, she had cystic fibrosis. So that was you go straight home, you can't be in here. You're too much at risk. There was about 10 staff out of the 99 that I employed that needed to either be at home or to go and try and protect themselves against the virus. And that included myself. And I was gutted because the doctor said to me, you can't go in, Zandra. If you catch this in its rawest form, you will probably be the ones that die of it. So I was like, okay. So I got a remote computer, got somebody to get me a remote computer, and on was it the 20th of March, I believe they closed the borders, which was a Friday, or they said that the first case had come. That's when I sent the people home from work, and that they ranged from kitchen assistants to trained nurses. And I took everything home, basically, to work from home, so that I could still support them with everything that was coming in. I could look at all the emails, I could look at everything. Then I would ring and say, I'm sending this to your private email, or I'm sending this on so that you have the most up-to-date information. We had a couple of residents between that time that I don't know if it was COVID or not, but they did have some symptoms because they had high temperature. But then when you tested their urine, it had blood in it and protein, and you thought, well, is this a urine infection? I had another gentleman that was sent to hospital whose pacemaker didn't seem to be working because he was only showing 35 beats a minute rather than the 55 to 60 that they usually set them at. And he was struggling. So we sent him to hospital and they accepted him. And I had another lady that had an acute bout of heart failure, and she's normally stable. So again, she was sent to hospital. And to be told 7 days later that they had COVID. Now, where they caught it from, don't know. Whether it was from us or whether it was actually from the hospital. They tried to send them back, and I said no. We had taken a couple of admissions from hospital, and I had asked them to be tested, and that was in the week before they closed the border. So that week, the sort of, I think it was 13th to the 20th or whatever, I had taken 2 patients from hospital. I had asked them to be tested, and they said no, there was no clinical reason to do so. And I said, well, I'm not taking them then. And then they said, well, the consultants were ringing me up and screaming at me down the phone saying, you've got to take these patients, there's nothing wrong with them. And I'm like, yeah, but just to doubly make sure, can you please test them? And they still refused. So stupidly or not stupidly, I don't know. I took those 2 patients, and then after the 20th said no more. I kept 5, because we were doing a refurbishment program at the same time. So I had kept 5 beds empty prior to COVID, and that was for refurbishment because we were in sets of 5. And so it meant that I could refurbish 5 rooms, move other residents into those rooms, refurbish another 5, and so on. Well, that was all put on hold, unfortunately, obviously due to COVID. So we decided to turn it into a little COVID wing in case. But alas, a couple of my residents that we moved out of there were wanderers. So to contain it, when you've got people that go into other people's rooms and use their toilets and go into other people's rooms and lie on their beds and do stuff like that, you can't lock them in the rooms. You're not allowed to. That's against every human right. And that was mentioned at one point, that I should lock them in their room. And I'm like, no, I can't do that. So anyway, COVID actually first hit the home on the 5th of April. That was our first confirmed case. And we had to plead with the government to come in and test this lady. Because again, she was a wanderer and she was going to spread it. Where she got it from, I don't know. She could have got, because we also stopped any bank staff coming from other places, because, that can cause problems. So I don't know how it got in. The only person that could probably tell me that is Rachel Glover. But I doubt whether she would tell me, because she had all the sequencing, didn't she? I don't know if she could or couldn't. So that's how it got in. Just going to take a cup of tea break. From there, it went from bad to worse, purely because 111 was disorganised chaos. It depended who you spoke to. 111, you'd ring them up, or a staff member would ring them up and say, I've got symptoms or whatever. They'd send them straight home. They wouldn't test them. I had, which I've submitted already, a list of people that were never tested in the beginning, that they just sent them home willy-nilly. So, of course, I lost 50% of my staff virtually straight away. If you'd been in the same car as them, as somebody that had been positive, even if the windows had been open or whatever, they were then sent home. They weren't even tested. They were just told to go home. And I'm like, but you can't do this. By then we had quite a few patients with COVID, and we were keeping staff that were just looking after COVID patients and staff that were not separate. However, it got to the stage where we didn't have enough staff. So I think Abbotswood's downfall, one of it, was I went on Manx radio to ask for help because I was not getting any from the government. And it was the Monday before, Easter. And I just said, if there's anybody out there that can supply me with good PPE, as in I was talking about not normal PPE, I was talking about hazmat suits, but I didn't stipulate that. And if there was any staff out there that wanted to come and say, just feed residents for me, or because then the nursing staff could go in, do the turns, check the residents, even if you only had 4 people, you could have 2 sets going and just constantly doing it if somebody else was giving them fluids and food. And that is the main thing with anything, that these people got fluids. I had also, we used to do subcut fluids, which there is some discrepancy about how effective subcut fluids are, but we used to use them when people had gone off and were not very well. We used to use them for 24 to 48 hours, and it often gave them a lift so that they could then get back to drinking themselves. So I'd ordered 36 1-litre bags of normal saline, and they could have used those at any time, and they chose not to. So that's what I was asking for. I was asking for help with anybody that wanted to help us clean, anybody that wanted to help the residents in any way. And the government, of course, and I also said, stupidly, when I think back, that I would blame the government if any of my residents died or my staff died. And I think that was the thing that they decided that they were going to go for me. And after that, I got a lot of people ringing me up from government, different departments, giving me lots of platitudes and lots of pats on the back, but no actual help, no real help. By the Friday of Easter Friday, things were getting to a crisis point. There was still staff there. It wasn't quite like Spain, but there was still staff there, but they were limited. I had only 2 members of staff on the EMI unit, and that was for 17 patients. And I had 7 staff on the main unit, which was for 40 patients at the time, because I had the 5 empty beds. So, and although they were still being looked after, they were still, you then had to change your way of nursing back to the old-fashioned way of task orientation rather than individual patient care, because you just had to do it that way. It was like a fluid round, food round, comfort round, you would just change the way that you did things. Staff were managing, but they were getting obviously very tired. And then as more staff were being sent home by 111, I wouldn't mind, but they were just sending them home. And it was like we were taking people's temperatures in the morning. And if they didn't have a temperature, they might have got a temperature by the evening, but it was already rife through the home. So it was like if people felt okay, I was saying, well, I was going against 111 at one point, saying, well, if you're okay and you haven't got a temperature, why aren't you working? Anyway, the crunch came on the Friday when the inspectorate, I said to the inspectorate, it's getting to dangerous levels of staffing. I need help. And they were like, oh, we've popped down to the nursing home already, and it seems that you're okay. I'm like, but what happens over Easter weekend if suddenly another 5 go off? We can't run it like this. We need some help. And then it was like, there's no help coming, no staff. They were already short at the hospital. Everybody was going off sick at the hospital. They didn't have any staff anywhere. So it was like, okay. I had to give a twice daily update to the CEO, Catherine Magnuson, who was so abusive and rude and a megalomaniac is the only way I can describe her. I've never known a person that is so full of their own self-importance, that had no clue about what we were up against. She had no clue about island life. She had no clue about anything, to be perfectly honest. She was making decisions that, in my opinion, were dangerous, to the point where I actually phoned up a lawyer at the weekend and said, can you help me with this? Because she's saying this. And she basically wanted to move. She asked me how many residents didn't have it at the time. And I said 10, not on the EMI side, because nobody at that point had it on the EMI side, but on the general side, I said, we've got 10 that haven't got it. She wanted to move those 10 to other nursing homes. And I said, you're having a laugh, aren't you? And she said, what do you mean? And I said, well, you're going to infect other nursing homes, because if this doesn't come out for another 5 days and they've got the virus and they're just harbouring it at the moment, you're then going to infect every other home on the island. She told me to be quiet and to get 6 of these residents ready for removal. So, and not to tell anybody or the relatives. And I said, I can't do that. I have to tell, I said, I don't have to tell the patients. I said, at this precise moment, I said, but I have to inform my nursing staff because they have to get things ready, like discharge papers and drugs. And you can't just send somebody somewhere else with nothing. So I said to her that she had to, I had to tell, and I had to tell the relatives. She screamed at me, because we had several meetings a day. She screamed at me once and said, I don't know what the hell you're doing at home. You should be in there with your staff. And I said, I've been told that I'm high because I was also on methotrexate. So I'm immune suppressed. And I was told that I couldn't go in. I mean, I was clutching, I really wanted to be there with them. She told me, well, other people that I know that have got the same kind of things as you have gone in. And I said, do you realise how poorly I am? And she was like, I don't care. You should be in there. She also told me that she'd had concerns for a while over my management style because I told the staff to get the patients ready, but not tell them until, the last minute, because I didn't want them overnight worrying or whatever. Then I went to my lawyer and said, look, what she's doing is mad. She's going to infect the whole of the homes. And I basically wrote down verbatim what he told me to say to her so that I could then come back the next meeting that we had and say, I've spoken to a lawyer and he's saying, that this is totally unwarranted. It was basically along the same lines that I'd said, but it was more in legal terms. So she kind of backed off with that and then decided just to move to. And then she backed off with that. So that's what I mean. Everything it was like, is this woman mad? She would then be asking for things that you couldn't give. I want a week of rotas. Well, I don't know who's going to be there tomorrow. I want a week of who's going to be on call, which I said, well, I'm on call, but I can't go there. I can just give advice over the phone. Or, if they want to FaceTime me, if a resident's ill, they can do that. She wanted to know so many things that we couldn't actually provide. And then they kept slamming us for the fact that we couldn't provide it. Because I said, look, my staff are busy looking after residents. That is our main concern, is to actually take care of them and to give them fluids. And then on the Monday, the bank holiday Monday, the GPs were all called up to the car park. All 3 GPs from Ballasalla Surgery were called up to the car park. And I was with them, and I got told to leave. And my sister, who was the manager, was inside, and she came out to find that they'd revoked our licence. And they then all walked in, the GPs included, a geriatrician and another GP. And they went round and they looked at every single resident. And they found 2 things. They found one gentleman who was complaining because he hadn't got out of bed in 2 days. Come on. When he had fed, watered, and he was comfortable. And they found somebody else with a pressure sore, who had already had that pressure sore, and she was already on an air mattress and being turned. So they basically didn't find anything. But they then went round and they put all of them, apart from 2 patients, on what I call TLC, tender loving care. which basically means Liverpool Care Pathway to them. It didn't to us, because TLC is you still give somebody fluids and food until they really can't take it anymore. Even if somebody's dying, you don't deprive them, because thirst and that feeling of being nil by mouth, that's horrible. So they basically went around and did that, put everybody on TLC. They wrote a lot of people up for midazolam and for diamorphine, and started giving it to some of the patients. Now, rather than trying to give fluids and, food, because that's what most people need to sustain life, they didn't bother. They basically, the ones that for TLC were written up for morphine and midazolam, and then they overdosed them as well. So my staff at that point was still there, dealing with the managers that had walked in to take over, who were nurses, but they were 9 to 5 nurses. They went at 5 o'clock, the license had been revoked, so they basically took over and were in charge, and yet there was nobody on call, there was nobody there after, as in a managerial position after 5 o'clock. As I said, the nurses, they found nurses from somewhere, I don't know where, but they certainly weren't particularly, when I say good nurses, that's not necessarily the case. They were nurses that had not got a clue about how to look after care of the elderly. They just didn't have a clue. And I don't know where they found them from. My staff were ringing me up in tears. I had relatives ring me up saying, do you know what's going on with my loved one? And I then had to get hold of somebody at work, and then was kind of using a private network because I couldn't get any information. The staff were actually there illegally, because as soon as they bring the licence, I didn't realise, but the staff shouldn't have stayed, because they tried to get them to stay by signing a contract, and my staff said, we're not working for you lot. Then they were getting Newlands ready, which used to be where I used to work a long, long time ago. So they were turning that back into bays of 6 so that they could take the residents that were COVID positive there, which is what they did. They were taking them 6 at a time. So they took them there, but they also took some of our equipment with them. So the place wasn't fit for purpose unless they stole, because they didn't ask, which so that is the stealing. They stole our airbeds and took them with them because they didn't have enough of their own. So therefore it wasn't fit for purpose. So, some of the residents did survive, but a lot of them, who were probably the frailer ones, would just leave them. One of my relatives said, who had her parents, both of her parents there, said to me, can you go and check on my mum, or can somebody go and check on my mum? So I sent one of the girls that I trusted from the EMI just to go and have a look at her and see how she was. And she said, Zandra, she said she was reaching out for a drink, and she just got a whole beaker full and just drank it in front of me. And I said, did you give her another one? And she said, yes, I did. And I said, okay. I said, she needs a drip. So I then phoned up the relative and said, you need to ask them to do a subcut drip. And they said no. Initially, they did do it in the end after another 2 days. By that time, it was probably too late, and she died. So 20 of my residents actually died, and none of them died on my watch, or our watch, should I say, Abbotswood's watch. They all died on the DHSC watch.
Just to clarify that point, during the COVID period, up until the point the DHSS took over, no residents had died.
One had died of, she was already palliative care. She'd come back to us from hospital with palliative care. She died. I believe they put COVID on her death certificate as well, but she wouldn't have died of COVID. And everybody else, no.
Okay, so in the period from the Isle of Man Government's Department of Health and Social Care taking over direct control of Abbotswood, what are we talking in terms of a time period then, as to you have?
A couple of them died the next day on the 14th or the 15th, and then the majority of them died afterwards during their stint.
Period in the following fortnight or month? Yeah,
fortnight to I think it was 3 weeks, because they moved out. And what was awful is that the last patient they moved out of Abbotswood, my staff weren't there anymore, but they were at the waving them goodbye at the entrance to the building. They were told to stop it because they were intimidating the staff, which they were saying, no, we're here for the residents, we're not here for you. And they went down to wave them off. And then a couple of my staff said, one of the residents, she was the last to be moved, and she was end of life by that stage. And they said, please, just let her be and die here at Abbotswood. And they said no, and they put her in an ambulance. She died in the ambulance. I mean, this is what you're talking about. This is the calibre of people. They just didn't have a clue.
I know you really alluded to it or said this, but I'm just re-asking because the information is so shocking, essentially. What you're saying is that when the Department of Health and Social Care came in, people were put on what we might call end-of-life pathways, whatever the current term is, which means they're denied food and water, and they're put on drugs like morphine and midazolam, which are respiratory suppressant drugs, and they're used in end-of-life. So irrespective of COVID or no COVID at that point, whether they had a virus or not, they were going to die from the end-of-life pathways.
Yeah.
And therefore it's accurate to say the Department of Health and Social Care, the Isle of Man Government, killed a number of people at Abbotswood, up to 20 people.
Yeah. And when our lawyers sent a thing into the police to investigate it, we were told there was nothing to answer to.
And that's because the coroner's office had already investigated and concluded the deaths were due to COVID.
I presume so. Or the death certificates all said COVID or whatever. I don't know because I wasn't there. I don't know what was going on, what they did and how they covered it up. But they made us out to be, they made out that Abbotswood was to blame, and it wasn't. I mean, yes, we might have lost 10, 15, we might have lost all 20, I don't know. But we certainly would have tried, and we certainly would have not just left them in their beds. That's just, they were our family. They were everything to us and to all my staff. My staff are highly traumatised still about it. Some of my staff are, including myself. But yeah.
In the period immediately after this, then, you're involved in legal action or a criminal investigation is brought against you, and that's dropped but results in a gagging order that stops you from talking about this for a prolonged period. Can you explain that chapter, please?
From the gagging order first came in from Catherine Magson, who said that I wasn't allowed to speak to any of the press or any of the whatever about what anything was going on. That if we spoke to the press or spoke to anybody about their actions, that it would have even more repercussions. They carried on hounding us. They went in after the last patient was removed, and well, they were there rather before the last patient was removed, should I say. They'd left drugs out, controlled drugs out. I know I'm going off the subject of the question, but I just want to reiterate this, that they'd left controlled drugs out. So they didn't go by their own code of practice at all. They'd put people's belongings in bags and hadn't even marked up who belonged to who, and it was just an absolute nightmare. They'd chucked out a whole load of wooden furniture because we had wood furniture, saying that it wasn't fit for purpose. They went through the home while they were there and went back 2 years on everything. 2 years on all the paperwork of every single resident, every single person that had either died, that had had a health and safety form, fall or whatever. They went back and they literally, I think, and this is from my perspective, and I'm sure that a lot of people think the same thing, because they went back 2 years on everything, they were looking to find something. Because initially they said the place was being closed because it was unfit for purpose because of fire eggs. It wasn't. We were like, well, where's the form that says, and they never produced it. Then they said it was unfit for purpose electrically, but that's them, that they pulled the wires out, and we have photographs to prove that. They made up all sorts. And basically, we were not allowed to say anything in terms of response to anything that they'd done, because they then brought out a criminal investigation on, how many of us were there? 5, on 5 of us. I was reported to the NMC for an unrelated incident that had happened back in the April, it was total mitigating circumstances, and it was just to, I think they did it to besmirch my reputation, because it was another thing, because it was reported in the paper that it was COVID related, which it wasn't. They then said that there was an ongoing investigation, and while there was an ongoing investigation, we shouldn't say anything to anybody. Our lawyers got involved and obviously said at this point, don't say anything, because we need to see where this is going. Then they decided that they were going to go for 5 of us, all for manslaughter, gross negligence, neglect, health and safety, and ill treatment. That's what we were smashed with in the October. And we were like, what? Where have these charges come from? What are you? We had some of them were in the police cells for a long time. I was questioned on 3 different occasions, both all for 8 hours each. No comment interviews, but what I was hearing, I just couldn't believe. That then caused me to have a mental breakdown. And I couldn't live with the thought that people would even think that I'd done something like that. So I tried to take my own life by walking into the sea. And then a couple of weeks later, I tried an overdose because the C hadn't worked. Somebody got me out of it. So, yeah, the police came and seized my phone when I was in the police cell, because they said, obviously, it had something on it. Well, I had nothing on it apart from, some WhatsApp messages between myself and, when they're saying, we don't know what to do about such and such. And then I would message them back and say, this is what I would do, It was a horrendous time. By the February of that year, they said they still hadn't charged us. We were just on bail, arrested but not charged. So that was a year. Then they sent it across for police to look at across, and they were obviously told it's ridiculous. So they then knew that by the April, but didn't bother releasing us from the charges until the June. So we were released from the charges of all that horrible manslaughter and everything. And there was a little snippet in the paper. I think it said, not enough evidence, rather than nothing to answer to. Not enough evidence, which is just how things are spun, isn't it? But health and safety are doing a criminal investigation. And I'm like, so, it's not the end of it. So everything was dropped against everybody apart from me. And health and safety were coming after me. So everybody else could breathe again apart from me. So that was in the June, they said that, and I heard nothing from health and safety for another year, where they said it was going to be forthcoming and whatever. And I'm like going to my lawyer saying, how is it progressing, whatever. And eventually this year, so it's 3 years on from when it started, this year in February, I signed a simple caution, which is different. It's not a criminal caution. A simple caution for the fact that I had left the building, but that was not COVID related. It was because my mother was on the floor, and I'd left the building for that 2 hours that was prior to COVID. And I thought, well, I did do. So whether it's mitigating circumstances or not, because my mother had breast cancer at the time and was not well, and she was falling a lot, and she'd fallen on the floor, and it needed 2 of you to get her up. And so I left the building with EU registered nurses, but they weren't registered with the NMC, but they were still brilliant nurses in charge for a couple of hours. So I took a simple caution for that, and I also took a simple caution for not filling out a ride or fall. And that was it after 3 years of absolutely destroying my life, destroying my reputation, being bullied, being harassed by public as well. I had been spat up in the street and called a murderer, and this was all the way the government spun it.
And when did the gagging order expire that allowed you to essentially sit here today?
It's because I've taken the cautions. It's over.
Okay, up until that point, so up until this year, you were still gagged.
Mm-hmm. I mean, now I can tell my story, and I haven't gone to the press because with all the things that are going on with Rachel Ranson, or Dr. Rosalind Ranson, sorry, with all the things that are going on with her, our case kind of runs parallel to that. So I haven't really gone to the press to spill the beans because it's not the right time. I'm waiting for the COVID inquiry to see what comes back from that. And then I don't know how I'm going to put it out there. I mean, you're going to put it out there, obviously, but I don't know how I'm going to, because I don't think they realise what they've done and how easily they can destroy somebody without a second thought. And they haven't learned any lessons from anything. And they're not going to, unless somebody with the strength of character can actually stand up to them. But anybody that has that strength of character is pushed down. I mean, the only person that's helped me a great deal through all of this is an ex-MHK, Chris Robertshaw. He knew that something was off from the beginning and he asked to speak to me. And I did speak to him off the record in the early days. And him and Peter Karen, they've always kind of tried to fight my corner for me. And I think they realise the damage that has been done, both physically and mentally. The NMC contacted me because I'm still under the NMC investigation, but they've contacted me and said that I can voluntarily remove myself. So I've said, yeah, that's probably what I'll do now, because I can't go back to practice anymore. I wouldn't want to really, although a couple of weeks ago, well, not a couple of weeks ago, it's a couple of months ago now, somebody was very ill on the boat and had a cardiac problem on the boat, and I went and sorted him out and brought him back, and you know, because I'm never not going to go and help somebody because that's an inherent thing of me. But if I can help, I will, because I have a lot of knowledge and I have a lot of stuff to give. I just don't know how to give it anymore. Does that make sense?
It does.